Hello, my name is Michelle Wynn. Today I'll be demonstrating drawing up insulin. I will be using gloves, alcohol swabs, medication vials, and a syringe. I will begin by verifying the physician orders. I will check for the six rights of medication administration, ensuring that I have the right patient, the right drug, the right dose, the right route, the right time, and the right documentation. I will verify the patient's chart in the EHR. I will verify the MAR to determine the medication. And if needed, I will perform any drug dosage calculations. It looks like the doctor has ordered 8 units of NPH and 4 units of regular insulin for a combined total of 12 units of mixed insulin. I will gather my supplies. I will proceed to my patient's room. I will knock before entering. I will close the door or curtain behind me to ensure patient privacy. I will place my supplies down on a clean, dry, flat surface, and I will perform hand hygiene. I will proceed with my patient. Hello, my name is Michelle. I'll be your nurse today. Can I please verify your first, your last name, and your date of birth, please? I have verified that information against 2 patient identifiers. I will use this opportunity to check my medication again. I will perform hand hygiene again and put on gloves. Thank you, Mr. Jones, for verifying that information. Do you have any known allergies, any drug, food, or environmental allergies? Okay, perfect. So today your doctor has ordered 2 different types of insulin. Insulin is a hormone that regulates blood glucose levels in diabetic patients. It facilitates the movement of glucose from your blood to your cells for energy. And as I mentioned, there's 2 different types that was ordered. There's one that it's regular or it's a short acting insulin. So it has a faster onset, but a shorter duration. And the second one is NPH, which is an intermediate acting insulin, and it has a delayed onset, but a longer duration. Some of the side effects for insulin is hunger, tremors, sweating, or injection site pain. Some of the more adverse effects are seizures, headaches, and confusion. Now, if you experience any of those, it's very important that you notify us immediately. Also, Mr. Jones, some people complain about burning or stinging upon injection. Do you have any questions? Okay, perfect. So I am going to check my patient's blood glucose level, and it's currently at 110. Mr. Jones, just to let you know, we will bring you a breakfast tray within about 30 minutes after administering this injection, okay? Okay, so I will check the MAR again to verify the order. I will call for a fellow nurse to come in. At this point, there will be 2 nurses present, and we will both verify every step going forward. Okay, so again, it looks like the doctor has ordered 4 units of the regular and 8 units of the NPH. So I will roll these in my hand, roll these between my hands, and this will help to resuspend anything and also to get it back to room temperature. I will clean the tops of both of these, dispose of that. Okay. And again, the nurse and I, we have both verified that we have the correct medication and we know the correct amount for each medication. Today, I will be using a 1 milliliter syringe. And another thing that you just want to double check with your insulin, you want to make sure that the regular is clear, and the NPH, since it's a suspension, is cloudy by nature. So to begin, I will withdraw 8 units of air. And I will have the nurse verify this with me. And then we are going to inject this 8 units of air into the NPH medication vial. I'm going to remove the top. Okay. Now, when injecting, you want to make sure that you do not touch the liquid. Okay. And now I will withdraw 4 units of air. And now I will have the other nurse verify this. And now I'm putting this in the regular medication vial. I'm going to inject my air, and now I'm going to invert this. And now I am going to withdraw 4 units. Tap to remove any air bubbles, and myself and the other nurse will verify this. And again, we are checking the MAR just to verify of the correct dosage. There's 4 units. Now I will withdraw the 8 units from the NPH. Now, when doing this, you have to be super careful because you don't want to release anything that's in the syringe into the medication vial, and you don't want to overdraw. So again, I started out with 4 units in here. I need 8 units, so 8 units of the NPH, so I should end with a total of 12 units. Okay. And again, I want to tap for air bubbles. Have the other nurse verify this with me. Okay. And I want to recap this. And again, I have my 12 units. So I have all of my medication. It's ready to go. And if I prepared this away from the bedside, I would label the syringe. I would put the name and the dosage.